Hi, this is Brandon with Chiro Up. We're going to talk about a little quick clinical tip on how to differentiate lateral epicondylitis with radial tunnel syndrome. And what we find is that about 10% of people who have a diagnosed lateral epicondylitis actually have a radial tunnel syndrome. And the problem with that is the treatments are very, very different. And if you start treating somebody for lateral epicondylitis and they have a radial tunnel syndrome, they're going to get much worse. So to make a differentiation, we find that most of our patients with lateral epicondylitis it's very tender and obviously sore when you push on that lateral epicondyle. Somebody with a radial tunnel syndrome is going to have their pain present about 4 centimeters distal to that point, and when you palpate that area, it's going to reproduce their symptoms. Now, they could have numbness, tingling, some paresthesia extending down into the first metacarpal, even the first thumb. However, they also could have some weakness in that area with finger extension if they have too much compression or irritation of that posterior interosseous nerve. And the way we're going to show that is by doing a middle finger extension sign. So I'm going to support her wrist and have her pick up her middle finger. If there's reproduction of symptoms of numbness, tingling, or even some pain and achy feeling going along that, chances are I have some radial tunnel syndrome as compared to a lateral epicondylitis. Now, there is cross innervation here, so if you're still able to do finger extension or wrist extension, that's not a differentiating factor between radial tunnel syndrome and lateral epicondylitis. We can also do a Tunnel sign, and with a Tunnel sign, using the pointy end of the finger, tapping right in that same spot, 4 centimeters distal to the lateral epicondyle, you're going to see reproduction of neurologic symptoms. Now, look at your Chiro Up protocol as far as how to manage one condition as compared to the other. However, of course, the biggest part is making the right diagnosis to begin with.